Back to the member for Nepean.
Thank you, Madam Speaker. My question is for the Minister of Health. At the Queensway Carleton Hospital in Nepean, over 30% of people that are using the emergency department are there because they don't have a nurse practitioner or family physician. Our hospitals are overburdened and our healthcare workers are burning out. A new report from the Montreal Economic Institute shows that for every 100 young nurses entering the profession, 38 of them are leaving. That's almost 40%, and we have to ask ourselves why. Nurses in my very own program have left the province to practice elsewhere, or even the country, or the profession altogether. While this government is focused on shoveling money through the Skills Development Fund to enrich insiders like Corey Tenike, nurses are being ignored. They continue to endure abuse, disrespect, and impossible workloads. So, Speaker, through you to the Minister, when will this government take real action to retain nurses by improving working conditions instead of just recruiting ones to replace those that are leaving?
Minister of Health.
Thank you, Speaker. I've said it many times, but it bears repeating. We have actually licensed over 100,000 new nurses in the province of Ontario since 2018. In the Ottawa region, through the leadership of our Minister of Colleges and Universities, we've actually been able to open up a new nursing program in the Ottawa University. Congratulations. It was game-changing for young people in the Ottawa region, Eastern Ontario, to have that opportunity to train in the community that they ultimately want to serve in.
Order.
Specifically, as it relates to nurse practitioners, we have invested $220 billion over 4 years to expand nurse education. That $225 million means that Ontario will continue to lead the country in the number of nurse practitioners practicing in Ontario. I'm going to repeat that because it's bear repeating. Leading Canada in the number of nurse practitioners who practice in the province of Ontario.
Member for Nepean.
Thank you, Madam Speaker. So my question was about retention of the current talent and nurses that we already have here in Ontario. You can talk about your record of investments and your record of recruitments. Great, that's great. But if you don't have the talent and experience and expertise that are already there to train those new nurses, we have a huge crisis on our hands. Exactly. We recently learned that at the North Bay Hospital, nurses are, quote, so afraid to make mistakes, they're crying in the bathrooms on their breaks, and that patients are not getting the care they need due to understaffing from funding cuts. I know nurses who have suffered permanent disabilities from violence in the workplace. It's no wonder that nurse retention in Ontario is 7% worse than last year and 68% worse than a decade ago. We need to make nurses feel valued again, and I have some suggestions for you. Number one, apologize for Bill 124. Number two, implement safe nurse-patient ratios. And number three, guarantee health care for all healthcare workers. So, Speaker, when will this government finally make nurses feel safe and valued instead of disposable?
Minister of Health.
You know, I look at the work that we're doing with scope of practice. And that scope of practice means that nurses, nurse practitioners, midwives have the ability to offer additional services and to make sure that they have that frontline care that is so critical. When I see the expansions that we've been making in our nurse education system, including, of course, one brand new program in the City of Ottawa, it speaks to a government who understands, as we continue to expand our capital through hospital investments, we are also expanding our health human resources. A $2.1 billion investment in primary care.
Response.
And what does that mean? It means that multidisciplinary teams of clinicians that include physicians, nurse practitioners, RNs, dietitians, mental health workers are working together